IVs in labor. Do you need one? What are they for? What are the benefits and risks? Are there any alternatives? I'm Shelby, I'm a maternity nurse and a doula, and here's what you need to know about IVs in labor. You will automatically need an IV in labor if you are being induced or getting any sort of medical intervention in your labor process. If you are receiving Pitocin in labor, you are definitely going to need an IV. It is given intravenously with IV fluids and titrated with a IV pump. Most providers will recommend that you get an IV placed in labor even if you aren't planning on getting IV fluids for safety reasons. Labor, while natural and safe in most circumstances, is very unpredictable, and we never know when things will go south for mom or baby, requiring extra fluids, extra medications, extra blood volume, emergency surgery. So having that IV in place in the hospital setting means that your team is able to intervene much quicker, and they don't have to worry about an extra step of finding a vein and getting an IV successfully placed when there's a bunch of other stuff going on. So it just skips that one step, and it's a little less crazy during the emergency if they do have that IV access and they can quickly respond to anything that goes wrong. On a labor and delivery, they will be placing a bigger IV because they want the option to give you fluids very quickly or to give you a blood transfusion or blood products in the event that you need it. If your specific labor does not require IV fluids or medications, you can opt to have what we call a saline lock. This means that the IV is placed, but there are no fluids running. This means that you have freedom to move around and you don't have anything restricting you. You don't have to worry about the IV pole or anything being tugged at when you are moving. You can just simply have the IV placed, get the blood work drawn while you are admitted, and then that IV will be in place without being used in the event that you need it. If you are wishing to use hydrotherapy as a pain relief option, you do have the freedom to do that with an IV in place. Your nurse will just cover it up so that the integrity of the IV is not compromised. But you can shower and be in the bath with an IV. Just be mindful of not getting it soaked and keeping it covered to reduce the risk of infection and to make sure you do not lose your IV access. Having an IV in labor means that you can receive hydration if needed. Sometimes people experience a lot of nausea and vomiting and diarrhea in labor due to the hormones or other medical problems that you are experiencing. The IV means that your nurse can provide you with hydration if you are unable to take it by mouth. As with anything, hospital policy is not law, and you do have the option to refuse an IV if you feel that is best for you. Definitely weigh the pros and cons, discuss it with your provider, and understand the risks associated with not getting one if things were to turn emergent. You can still have a low intervention birth and avoid any unnecessary medications or interventions, even if you do choose to get an IV. I myself had a spontaneous labor with my second baby. I did have an IV placed and I did not get any medications throughout the duration of my labor or postpartum experience. I had it placed because I felt better knowing that I didn't have to wait for someone to place an IV in an emergency situation, but that is a decision that is personal and up to you. If you are hesitant to get an IV in labor, most medications can be given via alternative routes. The Pitocin can be given as a shot in your thigh. Just because you don't have an IV doesn't mean you can't get those medications, but something like a blood transfusion can only be done with those IVs in place. The IVs placed in labor are preferably not going to be an AC IV. We don't want you to have to worry about bending your arm. Sometimes it can be uncomfortable. It can get in the way of trying to breastfeed or holding your baby. So a lot of the times your nurse will put your IV in your wrist. And the hand is another option, forearm. They do try to avoid the AC or the inside of your elbow if possible, so you do have the ability to move more freely. Most hospitals have standard procedure of administering postpartum Pitocin through your IV, and they will like that IV in place for several hours after the discontinuation of the Pitocin to make sure that your bleeding is stable and you do not require any further medications or fluids before that is removed. It can always be replaced, but we try to poke you the least amount possible just for your comfort and also to reduce the risk of infection. Your provider will check your hemoglobin and hematocrit, your anemia values after birth to see how those are looking and to see if you need any iron or iron infusions. And depending on those numbers, they might want to keep the IV in a little bit longer. If those are looking good, then your provider will order for your IV to be discontinued. Thank you so much for joining us today. I hope you will subscribe and join us for the remainder of the 30 Days to a Better Birth series. Have a good one.